Hi, I'm Matt Willis with a COVID-19 response update from Marin County for April 21st. We're currently sitting at 200 confirmed cases, which breaks down into 50 active cases, 140 recovered, and 10 who passed away. There are currently 6 people hospitalized. We've talked about the next chapter of what needs to be in place for us to begin relaxing certain elements of the shelter in place. Both the governor and Bay Area health officers that I'm working with agree that we must be able to measure any impact of any changes we make. I'm going to share with you some of the ways we'll detect early signs of increased infection rates in Marin County. This is part of our surge detection surveillance system. COVID-19 has a wide range of symptoms. But the hallmark of COVID-19 are the respiratory effects, cough and shortness of breath. When people need intensive care for this disease, it's generally because of the respiratory effects and potential respiratory collapse. We're obviously using COVID-19 testing and the rates of positive tests to measure local incidence. But even before people are tested, most people develop symptoms. And the most common early symptoms are cough and shortness of breath. This means we can look at respiratory illness rates as another early indicator of potential outbreaks or surges in cases. And here's how we're doing that. These are emergency medical services responses. So this is our ambulance response network. In Marin County, we have a single administrative umbrella over all the ambulances that operate out of fire stations around the county. They are submitting to us on a regular basis, even hourly, data from all the responses they do. And we're able to determine what is the nature of those calls. And we can measure those that are respiratory calls. What we see here is this is the percent of calls related to different conditions. We show for respiratory illness, it's usually between about 5 and 15% of the reasons people might call 911 for medical illness. What we're looking at here is different years over time, so 2018, 2019, and 2020. The red is 2020, and we show that what we're seeing in 2020 follows relatively closely to what we've seen in previous years. And importantly, we're looking over time to see if there's a spike. This red line shows that we're not seeing any significant spikes or increases in respiratory illness for people calling 911, which is reassuring that we're not seeing current surges. We're also looking at emergency department visits as an indicator of early detection for potential surge. Here you have all of the visits from our 3 emergency departments in Marin County, Novato Community Hospital, Kaiser, and Marin Health. They send us daily census reports of all the visits, including those that represent respiratory illness. What we see here is between about 2.5% and 10% of people who are in emergency departments are there because they're experiencing respiratory distress. What you see over time here is on the red represents 2020, and we did have an increase in respiratory illness right here in sort of mid-March, which does correspond to when we are also seeing increases in the numbers of cases. But here into mid-April, we're seeing normal activity relative to previous years and a stabilization of our rates of respiratory illness, which is another reassuring sign that we have flattened the curve. And we're also looking at this is another way of looking at our ambulance responses. This is the total number of ambulance responses that occur within Marin County on every day. So what you hear is, see, on any given day we have between 50 and 80 ambulance responses countywide. And what we're looking at here is this small blue line, which is the proportion of those responses that relate to respiratory illness, because we would see an increase in the proportion that might correspond to a surge. Interestingly, what we've seen is a decrease over here in overall 911 calls, which we know corresponds to the shelter in place and people using the healthcare system less, but also engaging in less activities that might lead them into the emergency department. So there's less overall activity, and importantly, the proportion of those calls has not increased with regards to respiratory illness. Another important part of being prepared for any changes in the shelter in place, in addition to the monitoring system I just described, is ensuring that we can interact safely when we're together. Marin County and other counties in the Bay Area issued an order requiring facial covering in certain settings starting tomorrow at noon. This order amplifies the existing recommendation to cover our face. It's encouraging to see how much we're already doing this as a community. Covering our face is something we do to protect all of us. Part of the new normal will be seeing your face covering as part of your regular clothing, something you always have with you when you walk out the door, and that you wear when you're with other people, especially indoors. Doing this well, together, will help eventually give us more freedom to travel and interact more. Your continued work as a community, sheltering in place, has flattened the curve over the past month and shows how powerful we can be when we act together. Thank you, Marin. Cover your face, stay healthy, and see you tomorrow.